Okay, let's unpack this. We are diving deep today into, well, what's arguably one of the most urgent and complex leadership areas right now, healthcare sustainability.
Absolutely. It's shifted, hasn't it, from maybe a niche concern?
Exactly, to something fundamental. The reality is, for any modern healthcare system, for real operational excellence, you have to integrate environmental thinking.
It's not just an add-on anymore. It's core to quality, to access, to everything.
So we have a really fascinating mission today. We're looking at six high-impact leadership projects. And these weren't just thought experiments.
No, not at all.
These projects drove real, actual, measurable change in hospitals from, well, all over the globe. Singapore, Zimbabwe, the UK, Kenya, you name it. They really focused on that difficult part.
They are immediate real-world examples. You see leaders facing really complex organizational issues.
Things like accreditation pressure, or maybe rising waste costs.
Precisely. Or dealing with aging infrastructure. And these leaders consciously chose to tackle these problems through a sustainability lens.
Translating those big strategic net zero goals into, tangible improvements, environmental, financial, operational. So our mission today is to kind of unpack these, go beyond just the summaries. We want to get at the genuine knowledge here, because these aren't just understand reports. Not only what these leaders change, things like reducing waste, decarbonizing kitchens, building climate resilience, but crucially, how they develop the specific leadership skills needed to navigate all those challenges.
These projects, taken as a whole, really show that modern healthcare leadership has to blend that clinical excellence we always talk about with, well, strong environmental and financial stewardship. You really can't succeed in one area if you neglect the others these days. And just to help structure that learning for you, we're going to be tracking some specific skill development against some established frameworks. So for those familiar, we'll be highlighting growth in the IHF leadership model, sub-competencies, think strategic vision, negotiation, sustainability leadership especially.
Okay.
And also, each project deliberately targeted a specific area within the SAT subdomains, things like low carbon care, sustainability action track, stakeholder engagement. We'll see how tackling these real-world complex problems actually forces that professional growth in these precise areas.
Right. Let's jump straight in then. Okay, so this first one we're unpacking, it comes from the United Kingdom. The project leader was Chloe Lee at Alderhay Children's Hospital, implementing a sustainable pediatric endoscopy theater.
The main focus here was really zeroing in on reducing environmental impact.
And improving leadership and governance too, right? Within that specific clinical area.
Exactly. And the core leadership competency Chloe was really working on developing was, well, twofold.
Okay.
Professional, ethical, and social responsibility. So showing that deep commitment to environmental stewardship, and alongside that, practical sustainability leadership skills, applying that multidimensional approach.
Got it. But the really strategic move here, it seems, wasn't trying to overhaul the entire existing 17-theater estate all at once. Instead, they decided to embed sustainability principles right into the planning for a brand new pediatric endoscopy suite.
And create a model that way.
A model they could then hopefully replicate across. Let's shift gears. Let's move across the world now from the clinical theater to thinking about organizational governance and regulatory compliance. Our second story features Christina, and this is at Kutek Puat Hospital in Singapore. Climate health engagement to align with the 8th JCI accreditation standard.
Yeah, you can see the strategy right there in the title. This project connects sustainability directly to, well, institutional legitimacy.
And risk management, I suppose, if you fail accreditation.
Absolutely. The focus areas here really spanned a few key organizational functions. Employee engagement was big, stakeholder engagement too, use of environmental resources, and overall governance.
And the leadership skills being targeted.
Primarily sustainability leadership, of course, but also really honing those interpersonal relationship management skills needed to engage a wide range of staff. The main goal was to design an engagement plan that could be scaled across the entire hospital. something that would build that baseline awareness.
And maybe foster a sense of accountability among staff.
Exactly. Across the whole diverse workforce, clinicians, admin, operations, everyone. They decided to focus on behavioral interventions.
Okay? Like nudges.
Exactly. Environmental nudges.
The key takeaway seems essential for anyone in this space.
Which is?
Frame sustainability as absolutely integral to organizational excellence. It's not an add-on. It's part of how you achieve high quality, safe, efficient care.
And tying it to existing unavoidable goals like JCI accreditation. That provides the necessary legitimacy and, frankly, the leadership traction you need to mobilize a large, diverse workforce that's already stretched thin.
Makes perfect sense. Okay, so we've gone from clinical efficiency in the UK to accreditation drivers in Singapore. Now let's shift focus again, maybe to something even more tangible. Physical waste. How about turning waste into a resource in Kenya? This next deep dive takes us to the Aga Khan University Hospital in Kenya. And the leader here was Dennis Mwangi. The project title is pretty straightforward. Biogas Project. Generating biogas for cooking from food waste.
They were focused on completely redefining how they handle waste, turning it from a problem into a resource.
Okay. And the leadership skill demonstrated.
It's sustainability leadership, clearly, but applied specifically through innovation and entrepreneurship. Thinking differently about a problem. First, they did extensive surveys of the hospital site. They looked everywhere for space. They quickly realized that conventional, large-scale biogas digesters, the kind you might see on a farm, were completely out of the question.
Why? No space.
Exactly. Hospital campuses, especially in urban areas, are often built vertically. Space is at an absolute premium. There simply wasn't enough land available or the right kind of infrastructure for a traditional, large, built on-site digester.
Okay, so the standard solution wouldn't work. They needed something different.
They did. They had to think outside the box. So they started searching the market specifically for highly portable or modular biogas solutions. They eventually selected a specific product, a modular system, capable of processing over 60 kilograms of their food waste every day.
Great points. Okay, our next project also dives into fossil fuel consumption and cost avoidance, but this time through a different lens, deep infrastructure changes. Let's head to Brazil.
Sounds good. Let's look at decarbonizing operational services there.
All right, this fourth case study takes us to Santa Isabel Hospital in Brazil. And the leader here is Fernando Lira. The project title is Reduction of Greenhouse Gas Emissions in the Nutrition Department of a Large Hospital.
Another one focused on the nutrition department. Interesting. This deep dive specifically looks at the use of environmental resources and achieving low carbon care, zeroing in on those core operational services.
And the leadership competencies highlighted.
Monitoring and evaluation was key here, really tracking the impact. And of course, sustainability leadership, but particularly the kind that requires driving collaborative action across different departments. The goal was to drastically reduce LPG consumption by entirely replacing the old failure-prone LPG burning cooking equipment.
Replacing it with what?
With modern, efficient electric devices, but with a crucial condition.
Which was?
Ensuring that the source of that new electricity demand was guaranteed to be 100% renewable energy. They installed specialized meters for both LPG gas consumption and electricity use directly within the nutrition service area.
Why?
To establish crystal clear baseline measurements before they changed anything, and then to precisely monitor the progress and savings afterwards. You need that data.
Right. So measure first, then what?
Then came the really significant capital expenditure phase, acquiring the new equipment.
What did they get?
They invested in 2 specific types of new, highly efficient, electric-powered professional cooking devices.
So we've covered targeted operational efficiency in a UK theater, using accreditation to drive engagement in Singapore, transforming waste into value in Kenya, and now deep decarbonization of services in Brazil. 4 very different approaches. For our next project, we're going somewhere arguably even more complex. We're looking at strategic vision and some really intricate negotiation happening across both public and private healthcare sectors simultaneously. Let's head to Zimbabwe. This features Trimore Chaga in Zimbabwe. And he wasn't just working at one site. He was managing sustainability interventions across multiple very different facilities.
That's right. On the one hand, you had the private Baines Intercare Medical Center.
Okay, a private hospital.
And on the other, two public sector facilities, Mount Darwin Provincial Hospital and Dotito Clinic. And the focus areas are equally broad. Infrastructure, energy efficiency, and waste management all rolled together into one overarching program.
That sounds incredibly ambitious. What kind of leadership skills would you even need for that?
Well, exceptional strategic vision, being able to see the big picture across diverse settings, and perhaps most critically, mastery of complex negotiation skills. So the overarching goal across both models was to establish genuinely climate-resilient healthcare structures.
Aiming for what specifically?
Aiming for operations that were moving towards net zero carbon emissions, had a significantly reduced thermal footprint, meaning they stayed cooler passively and achieved long-term operational resilience, even in the face of climate change impacts like heat waves or unstable power grids.
And what's the final key lesson from Trimore's experience in Zimbabwe? What's the takeaway message?
It's a really inspiring one, I think. Their key lesson is essentially always think big.
Think big, even when resources are scarce.
Yes, regardless of the perceived limitations or challenges of your starting point. In every solution you design, every intervention you plan, consciously prioritize the environment and sustainability. Even a small step that moves you toward the right kind of sustainable solution is actually a big step forward for civilization and for achieving true sustainability in healthcare. Don't let the perfect be the enemy of the good, but always aim high.
For our final project,
which really scaled up that collaborative effort, didn't it? Across a whole national system.
Yeah, this one's impressive in scope. Dr. Mohammed Osenafiri tackled achieving energy efficiency for the Egypt Healthcare Authority. We're talking 31 hospitals initially, with a pilot phase in 3. The focus here was pure cost efficiency through energy and resource optimization. And the leadership skills needed were significant. Leading change and driving sustainable transformation on a grand scale.
And the problem they faced was pervasive right across the authority. It was a mix of things. A lack of any systematic way to monitor energy use, a growing carbon footprint, but also critically rapidly rising electricity costs.
Compounded
by a systemic lack of what they called a conservation culture among staff. People just weren't thinking about switching things off.
Right. So how do they approach such a big systemic issue?
With a highly structured plan, moving from getting the data sorted to changing behavior. They started with baseline assessments, then created a single central database for all the electricity bills from all 31 hospitals. A huge task in itself.
Just getting the data in one place.
Exactly. Then they set up formal energy audit teams in each hospital, led by the engineering directors. These teams implemented daily monitoring checklists, energy-saving guidelines, and crucially, they paired this with strong reporting loops and motivation programs for staff.
So, data, structure, accountability, and motivation.
They quickly realized that relying only on human behavior, on checklists, wasn't going to be robust enough to future-proof those savings against such wild market swings in energy prices.
So what did they do?
Their response was strategic. They kept the continuous monitoring and the motivation programs going because you need to lock in that cultural shift, that awareness. But they immediately pivoted their future planning to focus on installing BEM's Building Energy Management System.
A powerful concluding thought for this set of case studies.
You know, reflecting on these really unique journeys we've just walked through,
Yeah.
from those very targeted digital workflows and simple checklists in the UK endoscopy suite, all the way to that incredibly high-stakes multi-sector infrastructure negotiation happening in Zimbabwe.
Right. The range is huge. Right.
But the core message that comes through, I think, is really consistent and quite profound.
Which is?
That leadership in healthcare sustainability, It's not a luxury. It's not some kind of optional feel-good add-on or a tertiary concern you get to if you have time.
No, these cases show it's actually a core driver.
Right, absolutely. A core driver of quality improvement, of operational efficiency, and fundamentally of organizational resilience in healthcare systems all over the globe.
And it doesn't matter whether the initial challenge was internal, like those rising food waste costs in Kenya, or if it was driven by external pressure, like the regulatory demands from JCI accreditation in Singapore.
Exactly. In every case, these leaders demonstrated that ability to connect really diverse institutional priorities, things the organization had to deal with anywhere, like finance, patient throughput, accreditation, waste management.
And connect those directly to environmental stewardship in a way that solved both problems.
That's the common denominator, I think. It's the leader's ability to use sustainability not as a separate issue, but as the essential modern lens through which they solve their most pressing operational pain points.
Yeah, it wasn't, let's solve the climate problem, and oh, look, we incidentally saved some money.
No, it was more like, we have a chronic maintenance problem with this old gas equipment in Brazil. Let's solve it by selecting a sustainable replacement that also cuts our energy bills and emissions.
Or we have a serious accreditation compliance gap around staff engagement in Singapore. Let's solve it by increasing climate literacy and using behavioral nudges, which also helps the environment.
Exactly. It demands the skills to bring together really diverse stakeholders, procurement, catering, maintenance, finance, clinicians, and not just inform them, but secure, genuine, deep buy-in. It requires highly developed negotiation skills, as we saw so clearly in Zimbabwe with Chimor.
Hostage negotiator.
Exactly. And it needs that ability to translate huge, complex, global goals like net zero into simple, tangible, culturally relevant actions that people can actually do, whether that's the shutdown checklist in the UK or aligning engagement activities with JCI standards in Singapore. So these projects, taken together, they really demonstrate that while successful healthcare sustainability definitely needs technical innovation, the fancy Iverio ovens, the portable biogas units, the planning for BEN systems, it is fundamentally driven by the commitment of leaders who can build those bridges and secure that deep, genuine buy-in across all those different, often siloed financial, clinical, and administrative stakeholders. Which brings us, I suppose, to our final provocative thought for you to take away and consider in your own context.
Okay, let's hear.
Well, the most successful projects we discussed today, they often highlighted a specific pattern. The solutions frequently involved either leveraging some kind of external pressure,
like the JCI accreditation in Singapore, or maybe national net zero commitments like in the UK.
Exactly. Or alternatively, they involved directly addressing an existing, often painful internal operational failure.
Like that old constantly breaking equipment in Brazil that caused so much downtime.
Right, or those steadily increasing food waste disposal costs in Kenya that were just eating into the budget. Real pain points.
Okay, so the provocative question for the listener is,
what existing external pressure, regulatory, market, or policy is your organization currently facing? Or what deep internal operational pain point, inefficiency, waste, cost, risk is causing headaches right now?
and could that pressure point or that pain point?
Could that be the foundation, the starting block for your next major sustainability-driven leadership project? So don't necessarily start by looking for a sustainability project. Start by looking for what you're already required to fix or what's already broken.
And then figure out how to fix it sustainably. Use sustainability as a solution. And then the final step. If you were the one to champion that specific change, what single critical leadership competency would you need to develop or strengthen first?
Would you need to become that complex negotiator, securing funds from different sources?
Right.
Or perhaps that sustainability leader able to convince frontline staff to embrace a difficult but necessary new protocol? Or maybe the innovator finding the tech solution?
Think about your next step. Identify the waste, build the case, align it strategically, and figure out the leadership muscle you need to flex. make your next move a strategically sustainable one.